Hi, thank you so much for joining us with Melissa Palmer's Survivorship Series of Cancer. I'm 42 years old, I'm a cancer survivor, and I'm interviewing caregivers. And today I have a very special guest, someone inspirational. She is a cancer caregiver twice, and I would love for her to share her experience with us and give some tips on how to be a good caregiver. And she also has done so much volunteer work for cancer. Linda, can you please share your story today?
I'd be glad to.
Thank you.
I just hope that we can reach out to other people, and if they hear our stories, then they don't feel alone. And I think that's one of the biggest problems as a caregiver, is that you do feel very much alone unless you reach out. So my first experience with this, I was only 30 years old, and my husband was 33. And he did not survive, and I barely survived myself because there just weren't services back then. I went to a function at the hospital for all of us caregivers and our afflicted husbands, and it was so depressing. I never went again. What I've learned now, it is now 40 years later, and I'm now 68 years old, and my second husband of only 12 years certainly was diagnosed with cancer. So now I am a caregiver for the second time, and things are going much better this time, both as a medical treatment as well as care for the caregivers. And Melissa's foundation really helped me as a person, as a caregiver. So let me tell you about it. There's like 4 things that I've really learned that I needed as a caregiver, and perhaps you feel the same way. It's a very lonely place to be unless you reach out and are honest with your own feelings, even though some of them are very negative. People who take care of caregivers recognize that that's how it's going to feel, and they make you feel more comfortable with those bad thoughts. Cancer patients sometimes can be very argumentative and depressed, and we don't all have the skills knowing how to deal with that. However, the social worker at the hospital where your primary care physician works can give you some really good advice and connect you with the right social services that the community has to offer for no charge. That's the first thing I would say, is reach out to your social worker and be honest, even with the negative things. I think the second thing I learned, Melissa, is that you need your girlfriends. If you're a caregiver and you're a woman, they understand your point of view and they understand your needs better than your own doctor will, or even your own psychiatric care will give you. You need a little bit of both. So I would say reach out to your girlfriends, again, being very honest with what your feelings are and what isn't going right with your caregiving. It may be something as simple as you need more meal delivery. You just can't keep up with the grocery shopping and the cleanup and the special meals that your husband needs. Many times their appetite just isn't there, and you try to make every little thing that they ever loved, and suddenly it doesn't taste good. Well, how do you deal with that? You've just spent 3 hours making their favorite chocolate cake, and now it doesn't taste good. There's people who you can tell that story to and they'll understand. So reach out to your girlfriends. I think the third thing I learned is you really need other caregivers to give you advice about how to take care of yourself. If you can't provide for yourself, then you can't give care to anyone else. And that means taking a break. 40 years ago, there weren't such services. Now there are. That social worker can also connect you to the caregiver support system that will give you an hour off, 2 hours off, or even a whole afternoon off. Somebody else will come in and volunteer their time to be with the afflicted cancer patient while you go and do what you need to do. Maybe it's grocery shopping, maybe it's a hair appointment, maybe it's just going to Neiman Marcus or Target to shop a little bit. retail therapy can kind of help the caregiver too. I think one of the fourth things I learned is that the cancer patient needs to know your honest feelings about their cancer. By hiding your own feelings, they well up and then they explode in a very negative way for both of you. And I think that the cancer patient is not the one to bring it forward and bring up the topic. You almost need to. You need to be the one that say, it makes me so sad when I see you in such pain from your chemotherapy. I just need you to know that I go in the bathroom and cry. He needs to know. She needs to know. And together, you can make the progress.
Oh.
It's difficult. I know you know. Oh, yeah. This is what the girlfriends are for.
Oh, I know, Linda, and you are a wonderful caregiver.
We try, but I know it's not always easy. And that's when you gotta reach out. That's when you need your girlfriends and you need the social worker. So take advantage of all the things that Barrington has to offer. Believe me, people are willing to help if you just ask. That's my motto, just ask and be real.
And it is a very, very lonely position to be in, to be a caregiver, because everybody gives attention to the cancer fighter and the cancer survivor, and they don't give any attention to the caregiver, and they're going through some of the same feelings.
Exactly.
So, anyways, I would like to thank you, and I'm glad that Cancer Soul Survivors helped when you guys needed it.
That was one of the best things for us, was those little gift baskets with all of the things in it that we needed to buoy our spirits and keep the fight up. And it's working. My husband's doing just great.
I know, her husband is a wonderful man. And also, I'd like to tell you a little story. We did Christmas baskets for all the residents in Barrington that were undergoing chemotherapy. And before Linda's husband was diagnosed with colon cancer, she helped fill and stuff those baskets for hours. And it was kind of like a pay it forward movement. Who would have ever known that 6 months later, her husband would be diagnosed with cancer? So thank you so much for being here and sharing your story. I hope that it helps many, and please reach out to the caregiver.
Thank you so much for having me, and I sure hope this has helped somebody else. That's what we have to do. Pay it forward. Be real.
I agree. Pay it forward. Thank you.